so excited to have Stephanie Daniel here with us today. She is an integrative physician who practices functional medicine in San Rafael, California. And I love collaborating with other powerful women, especially women that are utilizing food as medicine in their practice and lifestyle and really empowering people to make the best choices that they can in their life. So thank you so much for being here today.
Thank you so much for having me. I'm excited to be here.
Yeah, so I would love to talk a little bit about your background because you obviously have a Western medicine training, and I'd love for you to give us some tips on making healthy choices and, you know, preventing disease, and then maybe we could talk a little bit about the program and how you look at food as healing in your practice.
Yeah, absolutely. As you mentioned, I did my training as a physician. About 2 hours of that entire 4+ years was based in nutrition. That's
so
it.
Crazy. And so, like, what kind of nutrition stuff do they teach you?
They only really focus on heart disease and the role of omega-3 fatty acids, and not much mention of sugar. If you go to any hospital today and you look at the food tray they give to diabetics, that's supposed to be no sugar added. It's toast and jam and juice and all kinds of sugary laden foods.
It's so crazy because obviously most inflammatory diseases like heart disease and stroke and diabetes are directly related to the diet that you eat. So it's crazy that we're kind of leaving that information out for people.
Completely left out. Western medicine is focused around using medications to treat disease, or rather, as I see it, more symptom management. Because oftentimes you're not really treating something, you're just making it not progress.
Yeah.
So in my background, I ended up researching and writing about a book before I went to med school that was about nutrition and stress, or food and stress. And that got me very curious about how food could be used as medicine. It could be used not only to reverse disease, but also to treat it. So in my current practice, which is functional medicine practice, which for anybody who doesn't know what that is root cause resolution, trying to find out the why that somebody has the symptoms they have, and then reverse engineer how they ended up getting sick so that they can find their path to optimal wellness again. And you can't do functional medicine without a foundation that's rooted in nutrition and lifestyle integration.
Yeah.
So the primary, main driving factor that I see in all my patients is that almost all of their symptoms and disease processes are driven by inflammation. And I love what you've done with this cleanse. It's highly nutrient dense, it's highly anti-inflammatory, and I'm just excited to have everybody see all the goodies that you've got.
Yeah, I'm so excited about it. It's such a great program. So what are some tips that you would give people that are kind of feeling sluggish, not feeling good? Maybe I used to see in my practice, people would come see me and they'd be on like 6 different medications, and they would feel tired and sluggish and have these chronic symptoms of fatigue and pain in their body. And through acupuncture and changing their diet, I would see amazing results. But what are like some tips that you could give us just that would apply to almost everybody, like some universal tips?
Well, it probably goes without saying, anti-inflammatory diet means like sugar-free, no processed foods, no refined carbohydrates, lots of live, raw foods, and nutrient-dense phytonutrients like in vegetables.
So just to recap, because a lot of people don't really know what the inflammatory foods are. It's anything that's packaged, processed, white flour, white sugar, finely milled grains, soy, wheat, corn.
Yep. Dairy. Peanuts. We said sugar.
Yep.
Can't emphasize that enough.
And sugar in all forms. I think a lot of people don't understand that if you eat a piece of white bread, your body processes it just like eating a couple teaspoons of sugar.
Right.
So you want to stay away from anything that's finely milled and finely processed. And really, I think the bottom line is you just want to eat real food that's plant-based, that's in its natural form. So, eat the colors of the rainbow, green veggies, beets, carrots, they all contain phytonutrients that are so healing and, like you were saying, prevent disease.
Absolutely, yeah. And reverse disease, actually. If all my patients, when they come to me, immediately get put on an anti-inflammatory diet, and the number of times that by the time they come back with their test results that they're, 50 to 100% better is pretty much across the board.
That's so amazing.
True, yeah, it really
and
is.
what about, when you do anti-inflammatory, are you doing organic?
Always organic because of the issues with GMOs and pesticides and the effect that has on disrupting the microbiome, which again is one of the primary reasons why everybody's sick. Is we have all these gut bugs that are supposed to keep inflammation down and keep our immune system strong, and all those foods that you mentioned to steer away from are the ones that destroy all those good bugs.
And it's so important for people to know. A lot of people don't know that if you are eating non-GMO and it's not organic, that most of the time with wheat grains, for example, they're soaked in glyphosate. So even if you're eating non-GMO, you can still be eating food that's heavily sprayed, and that really messes up your gut.
That's right. And then those toxins also affect your liver, and then that affects your hormones and your brain chemicals, and on down the cascade of whatever symptoms that a lot of people walk around with. Fatigue being, I think, the number one thing I see is the low energy.
I know so many people are feeling tired and sluggish.
Yeah.
So which gets us back to this program, the Metamorphosis program. So we're doing, low glycemic green juices till noon, and then these beautiful soups and salads and tinctures and shots. And how do you feel about eating a diet like that? For some people get worried and they say, should I ask my doctor? And I always say, fruits and vegetables are what we're meant to eat and are so healing. And so those are foods that you really don't need to worry about. You really need to worry more about all the other foods that we just talked about.
Yeah, absolutely. No, I mean, I think it's what you're providing is very nutrient dense. You're feeding people throughout the day so they're not wasting away any muscle. And you're giving them the nutrients that also help them cleanse their liver and recolonize all those healthy bugs in their gut. And one of the things that I like about the fasting with green juice until noon is that gives the liver a break so it can detox, but then it's also really a very powerful immune booster. There's this whole science behind intermittent fasting, which we think about in terms of at least 12 hours between dinner and your next meal. So being able to do the green juices until noon allows that process to happen in the body.
And it's so great because when you do that, your energy levels get so much better, and all people's head clears. And it's so surprising how just giving your body that break until noon makes such a big change.
Huge change, right? And then you're nourishing with all these great cruciferous vegetables and lots of the recipes that you have, and lots of nutrients. The pumpkin seeds have zinc, which are also great for thyroid health and immune boosting. Let's talk about some of the other ingredients that you have in there.
We have adaptogens.
Right, the adaptogens and is it the endurance formula?
Yep, the endurance has rhodiola and cordyceps.
Right, which is really good for the adrenals to be able to counteract all that inflammatory response that it's been dealing with until you've done this cleanse and this diet.
And we have turmeric, and I think like pretty much all of the ingredients are, like you said, are anti-inflammatory.
Absolutely.
Which is so huge, which helps like with pain and like you said, preventing disease. And what about, lastly to end, what tips would you give somebody that is doing this program and feeling really sluggish and tired and really wants to get back on track, like that person that might be on a few too many medications, and like what are some things, like some people might not have access to somebody like you, so besides doing a diet like this, is there any other kind of tips that you can give?
Getting plenty of rest, at least 8 hours a night, because it's a way that our body restores and it heals, and it allows our even our nerve cells to clear out toxins. So good sleep, plenty of water. Hydration is important. I saw that you had a hydration formula as well, which is really great, full of minerals, magnesium, which is really important for sleep and relaxation and brain health.
And most people are deficient in minerals and they don't even know it.
That's right.
And so sometimes by taking minerals, it can make a huge difference in your energy and your health.
Yeah, you're replacing a lot of nutrients that act as cofactors for all these enzyme reactions that our bodies are full of, that have been halted by all the sugar and processed foods and chemicals on the pesticide-laden produce and such that we've been eating. So all very good.
What about exercise?
Absolutely.
So
Yeah.
important, right?
Yeah, very important. Really good for lowering stress response and inducing a parasympathetic nervous system response, which is the part of the nervous system that's not the fight or flight that we're always in.
Yeah.
You know, busy, go, go, go.
Yeah.
So absolutely exercise for sure.
Yeah, perfect. Well, thank you so much. And like I said, I'm so excited that more physicians like you are coming out and really helping your patients be empowered and make healthy choices so that you don't have to be on a ton of medication and live
Right.
your life like that. So
Yes.
thank you so much for all the amazing work you do. And we're so excited that you did this for us today.
Thank you, and thank you for all the amazing work you're doing and empowering people with more tools so they don't have to rely on medications to just manage.
Yeah. Thank you.
Yeah, thanks.